Every day I'm in the office, I have some conversation with my patients about them not wanting or them not taking medications I prescribed or that I want to prescribe, them not wanting to take medications I wanted to prescribe. There's a lot of reasons I've learned why my patients don't want to take medications or don't take the medications I prescribe. So we are going to go through the 7 most common reasons why patients, they're most common to me, 7 most common reasons that I see that my patients or patients in general do not want to take the medications that their doctor prescribes. Okay, number 1, fear of side effects. Okay, I have a number of patients that I've seen over the years, even some today, that are concerned about side effects. Whether it's anxiety or depression medications, cholesterol medications, blood pressure medications, asthma medications, you name it, okay? Side effects, I would say, is one of the biggest things my patients are concerned about when they express to me that they don't want to take a medication or they're reluctant to, or that they don't, is side effects, okay? Number 2, no particular order, cost, okay? We might prescribe a medication, and by the way, guys, we don't always know how much something is going to cost based on your insurance plan. Sometimes we have an idea, many times we don't. So one thing I will tell you is that if you're ever prescribed a medication and it's way, way, way cost prohibitive, okay, it's important for you to feel like you have the agency to communicate this, to your doctor that, hey, this is too expensive. And I've had a lot of patients over the years that just don't take their medications or they ration them, take a pill every other day, cut them in half, things like that, to make them last longer. If you are doing that and cost is a problem, please let us know so we can help. Sometimes we have samples, sometimes we have coupons, many times we can change the medication altogether. We can try to help out. And some pharmaceutical companies have programs that patients can directly apply to get assistance, okay? Number 3, I have a number of patients that don't want to or are reluctant about meds because maybe they don't fully understand why I want them to be on a medication. In other words, there's a misunderstanding about what the medication is for and maybe the importance of the medication, like what it's supposed to do. You know what I mean? And let me be clear. Maybe I should say, sometimes we as doctors don't explain well what medications are for. How about we say that? Huh? Yeah. Okay, sometimes we don't tell you what we're giving you the medications for and why they're important. So if someone has a misunderstanding, if you don't know what it is that you're taking and why, you may not think it's important to take and therefore may not take it, okay? Number 4, no particular order. I have patients that will tell me, or they feel that they don't feel bad. So why do they need a medication? Take high blood pressure, for example. That's a classic one. Cholesterol is pretty much similar too. You're not likely going to feel high blood pressure unless it's super severe and it's sort of what we call either end stage or it's an emergency, blah, blah, blah. You're not going to feel it. Now, some people feel like they get headaches and this and that when they have high blood pressure, but I would say most people, when their pressure is high, don't actually know it, okay? And so some of my patients have expressed to me over time, they've even said things like, well, doc, I feel fine. But please understand that feeling fine doesn't necessarily negate the need to take medications, okay? Because it may be doing something in your body and helping out all your organs and things like that without you even knowing it, helping you on the inside. So please just understand that that's the case, okay? Number 5, no particular order. You may not trust your doctor. Why do some people not want to take the medications their doctors have prescribed? They don't take the medications their doctors have prescribed. They don't trust the doctor, right? And that's a problem. It's a problem for us doctors. And it's unfortunate for patients. That's not the situation I want. I don't want you as a patient to feel like you're being taken care of by a healthcare facility or a doctor, et cetera, a healthcare provider that doesn't actually have your best interest at heart or doesn't listen to you or that you simply don't trust. It's really hard to follow instructions and to believe and to listen to someone or something that you just don't trust. Next is people worry about becoming dependent. I hear this all the time, that they say, I had a patient say to me today, will I have to be on this forever? Will I have to take this for the rest of my life? Or will I become dependent on this medication? Will I ever be able to get off of this medication? This is one of the things I think that keeps a lot of my patients from wanting to take medications is they're concerned they will become either dependent, which by the way is only a small percentage of medications, or they will have to take it forever. The next thing and the last thing is I think a lot of my patients don't want to take medications because and I literally said this to someone today. I get this sense, and I also want to know what you think. I get this sense that sometimes my patients feel as though they're somehow less if they're on medications. Like somehow it's a badge of honor if they're not on medications. It's like the ability to say, oh, I'm not taking any meds. I get the sense that some of my patients feel like there's a sense of pride in being able to say that. And by the way, I get it. But that the alternative or the idea of being on medication somehow is almost like getting a bad grade on a report card or implying that you're somehow less. And I actually asked some of my patients about this, who have seemed to me as though they take a lot of pride in not being on medications. And so they don't want to take medications being recommended because they feel like somehow that makes them less than, that they prefer to not be on them because they think that that's a better way to be. That seems like a better way to be. And you know what I say about that is I think it's important for us all to examine why we think the way we do, okay? I say to my patients, if a medication is going to allow you to live till 115, as opposed to having a heart attack in 5 or 7 years, 115 is a joke, guys. I'm just saying this. If a medication is going to drastically reduce your risk of having a heart attack versus not, it just seems like taking that medication is by and large the smarter, healthier thing to do. And I also want to remind us that your need for a medication doesn't mean there's anything wrong with you. See, remember, everybody's different. Some people are born with genetic conditions, genetic predispositions, conditions that you absolutely have no control over, that you didn't do anything to cause, but they are there. You know, medication is not a sign of a weakness. It's not a sign that you're flawed or that you're somehow not as good as. And if for some reason you feel like society is making you feel this way, then that is wrong. Because the truth of the matter is, if taking 3 or 4 or 5 medications is what's going to allow you to live a long, healthy life, then that by far is the best thing. Then not. And remember, not taking medications that your doctor has prescribed you because you don't like the idea of being on meds doesn't actually take away the condition that they're trying to treat. Doesn't make it go away. If you choose not to take blood pressure medication and you need it, not taking the medication doesn't make the blood pressure go away. And you're still at risk. You're just not doing anything to help and to improve your chances of, say, not having a stroke or not having a heart attack or things like that. So what I challenge us all to do is to think about why it is that we are opposed to medication, if you feel this way. And the first thing, as I mentioned before, is to tell your doctor, hey, look, I don't know about this. I don't know if I want to take it. I don't know. I'm not sure. Tell us so that we can help understand why you feel that way. The idea is think about really what it is that you're feeling. Because what it comes down to is risk versus benefits and being honest with yourself and your doctor. Now, the bottom line is you don't have to do anything you don't want to. You don't. But what I always say is before you or someone else decides to take a medication or not, or rather, I say even to take it or not, especially not to take a medication, it's going to be really, really, really important to understand what could happen if you don't take it. So at least you're informed. You know, and this goes down to understanding why your doctor wants you to take it. If you don't want to take the blood pressure medication or the asthma medication or this and that, say, doc, if I don't take this, what could happen? And that way, at least you're informed. You know. And you can make an educated decision for yourself. We have to look at every situation as they come, every patient as they come, and decisions have to be made individually for each person. But what I ask is that you not block certain things out because it doesn't fit within the box of what you're hoping for. Because sometimes we need a number of different things. It's so good to see you. Make sure you like and follow my page. Guys, I do daily videos on all sorts of stuff. I love y'all, as always. I'll be back tomorrow with more stuff. Thank you guys for the stars. YouTube, thank you for the super chats and the super stickers. Mwah. Guys, I'll see you soon.